Hello there, this is Dr. Bernardo Ng with another mental health tip from Sun Valley Behavioral. Thank you for listening. Today, we're going to talk about OCD. Very common word now. People know it. It's Obsessive-Compulsive Disorder. It's an illness. And you know what? Most of the time, it starts in childhood. And it waxes and wanes, so that's why sometimes people don't get treatment because they think it's going to go away again. But every new episode of OCD or exacerbation of OCD can cause problems in your brain and can make it more difficult for the symptoms to respond to treatment. Okay, so OCD is basically two types of symptoms: obsessions and compulsions. Okay, so we're going to talk about obsessions first. Obsessions are intrusive and hard to control thoughts that get in your brain and in your mind of things that you know cannot be true, but you cannot get rid of them. And what I mean with that is that just because you touch a doorknob or you touch the handle on the car door, or you pushed the door of Starbucks to go in, or you shook someone's hand, that you're going to have all these germs now grow in your hand, and then you're going to get infected, and then you get sick, and then you're going to die. And you think all of that within seconds. And then in another 2 hours, you're thinking about it again. In a few seconds, these thoughts repeat themselves and repeat themselves and repeat themselves to exhaustion, okay? The thoughts could be not about germs, could be about danger, could be about becoming gay, could be about swearing in the middle of mass at church, could be having to count everything goes your way, having to count all the cars that are coming your way, or having to count all the lines on the road. Things that are exaggerated, ridiculous, and have no purpose. That's obsessions. Now let's talk about compulsions, okay? Compulsions are actions or behaviors that you feel compelled to do in order to address your obsessions. Classic case, you have this thought that all these germs are invading your skin and are going to get into your bone, so you go wash your hands over and over and over and over again. It can be manifested in different ways and can actually be risky. Some patients, for example, take showers. It's not just washing their hands. And they take showers and they scrub with soap and again with showers that can take an hour, 2 hours, 3 hours. Sometimes they do it and they may run out of hot water and it's winter and they just keep on going with that shower. People who, for example, have the obsession that the mileage meter in the car has to end up in zero everywhere they go. So they arrive to their destination and then they have to drive around the block again because it didn't end in zero. And they do it over and over again until so they waste all this time. These guys are contaminating, getting late to their appointments, etc., etc. Okay? So what's happening there? It is believed that it's a problem between the centers, the basal ganglia, which are these centers in the middle of the brain, which are these conglomerations of neurons that don't communicate well with the frontal lobe. And in that, there is a communication and a dysfunction of the transmission of dopamine and serotonin, and therefore you cannot control those thoughts. Okay, so treatment is very effective most of the times, but usually takes very long to be in treatment. It is a combination of psychotherapy, one called CBT, and medications of some that you probably heard about that are called SSRI at actually very high dosages. And most people do very well and their lives can change. So if you or someone you know is having symptoms of obsessive compulsive disorder, please call us. The number is 355-0161, or you can find us at our website, www.sunvalleyreview.com. Thank you for listening to this mental health tip from Sun Valley Behavioral.